Dr. Ken Landau. Thanks for watching. Let's talk about fentanyl. Fentanyl is a generic product. It comes as either a patch that you can put on your skin, you can rub it on your gum, you can put it under your tongue, you can spray it, you can use it as a lollipop. Has a bunch of different kinds of trade names. Trade name that you might have heard of is Duragesic. That's the patch you put on your skin. Actique, that's the lollipop that you can suck over a period of 15 minutes. About a quarter of it's going to be absorbed right through the mouth. The rest you swallow and it's absorbed normally. There's Abstral, that's a sublingual spray. We know that it is a synthetic opioid. It's similar to morphine, but it's much more potent. It's 50 to 100 times as potent as morphine. Obviously, it's a Schedule II narcotic, but a lot of it is brought in from China, and it's altered either in China or here in the United States. Those are Schedule I. Those are illegal drugs. Fentanyl was originally synthesized in 1960 by a doctor known as Paul Janssen. It's an analog, structurally similar to Demerol, was first marketed as Sublimase. In the 1990s, it came out as the patch, and in 2000, it came out as the lollipop. Then came the dissolving tablet, then the sublingual spray. We know that fentanyl was initially approved by the Food and Drug Administration in 1968. It's available in generic products at the present time. Most commonly used is a transdermal patch, a patch that you apply to the skin that releases anywhere between 12.5 micrograms, not milligrams, but micrograms, tiny amount per hour into the skin, all the way up to about 100 micrograms per hour. Now, the difference between a therapeutic dose that's going to take care of your pain and a lethal dose that's going to kill you is very small, and unfortunately, quick tolerance develops to this kind of drug, so there's always the need for more. Well, the effects of this drug are basically exactly the same as heroin. You start off with euphoria, then you get nauseated, then you sometimes have a problem with drowsiness and confusion. Definitely you're going to be constipated if you take this drug. There's sedation, there's respiratory depression, respiratory arrest, there's loss of consciousness, coma, and death, all very common with this drug. Now, it's also a drug of abuse. It's frequently used as a drug of abuse. Street names for this kind of medicine are known as Apache or China Girl or China White, since it's imported from China oftentimes. It could be called Dance Fever or Friend or Cash or a Good Fella. It's also known as Jackpot or TNT. It's often sold as white heroin. That's a significant problem, especially back on the eastern seaboard, where white heroin is very frequently used and abused. It's sold, unfortunately, as a powder, and it's very concentrated and incorrectly diluted. It's put on blotter paper that you can put in your mouth. It's mixed with, or it's substituted for heroin. You can swallow it, you can snort it, you can take the blotter paper in, you can inject it. The problem is, remember, that it's 25, 50, or even 100 times more potent than heroin, and as a result, there are a lot of deaths. It's estimated that every day in the United States, 30 people die from overdose of fentanyl. That's a major problem. Now, you do not use this drug in people who have not used or have become tolerant to the action of one of the opioids, like hydrocodone or oxycodone. You have to be using those drugs first. This is not a drug that you use for acute pain or intermittent pain. You don't use it after you've had an operation. You don't use it after day surgery or tonsillectomy. You don't use it for short periods of time or even for mild pain. And it's not for people who have some sort of respiratory disease. Maybe you've been a smoker and have chronic obstructive lung disease, emphysema, bronchitis. Definitely not for you. It's not for people whose intestines don't work correctly, people who have slow intestine or what we call a paralytic ileus. It's not for people who have spasm in the gallbladder area and biliary pain. You have to be very careful if you either have a personal history or a family history of addiction, if there's any mental illness or depression in the family, if you use alcohol, or even if you take sleeping pills. This is just not the drug for you. And there's an increased incidence of side effects if you take other kind of medicines, if you take sedatives, you take a sleeping pill or a hypnotic. You take a tranquilizer, a phenothiazine, you take some alcohol, or any of the other opioids, you have to be careful. And so too, if you're taking one of the antidepressant drugs that we call an MAO inhibitor, and anticholinergics that are used for certain lung diseases, or even just over-the-counter Benadryl acts as a drug that's in the anticholinergic family, and as a result, it can cause urinary retention and cause problems with your intestine, respiratory problems. You don't use this drug if you have any history of chronic obstructive lung disease, or if you have a very slow heart rate. You have a high chance of respiratory depression when you initiate the dose or when you change the dose. Accidental exposure to children is often fatal. Use in pregnancy can lead to intoxication of the fetus, harm to the fetus, birth of the fetus with withdrawal syndrome. Major problem. There's a black box warning on the drug talking about the respiratory depression that goes along with it, the medical errors that may occur that can kill you, and the potential for abuse, even if you use the drug the way you're supposed to. Now, it's an analgesic, it's a painkiller, of course, but it can lead to a change in the mood. It can lead to a euphoria, an upper, or a depression, a downer. It can lead to drowsiness. It can stimulate a certain area of the brain that controls nausea and vomiting. It can depress your respirations, lead to hypoventilation. Most of us breathe 12 to 16 times a minute. People who take these drugs breathe fewer than 8 times a moment. And it can decrease the propulsive movement of the intestines. Well, it binds to the opioid receptors in the brain and in the intestine. The problem is it's what we call lipophilic. It binds to fat, which I'll tell you about in a moment. But that's very important. It also means that it can cross the blood-brain barrier, gets into the brain, and it can stimulate the release of a chemical known as dopamine from the reward center of the brain, leading to some euphoria, good feeling, and relaxation. But I mentioned a moment ago that it gets into the fat. Well, if you're taking the drug for appropriate reasons, and let's say, unfortunately, you have cancer, or you have severe infectious disease, or maybe you have terminal heart disease, well, as you lose the weight, and you lose the weight very suddenly, then a lot of the fentanyl is going to be released into the bloodstream, and that can kill you because you get too much quantity. And if you happen to have lung disease and you retain carbon dioxide, that causes the skin blood vessels to dilate and you absorb more of the drug. And if you have acidosis, you can have acidosis, your body can be somewhat acidic simply because you're retaining the carbon dioxide, or maybe you have diabetic ketoacidosis, maybe you don't have any appetite, either because of the drug or the disease, and now you become acidic. Well, you're going to absorb more of the drug because it's not going to be bound to the protein. It's going to get out into the system and then do its harm. The side effects are legend. There are just an enormous number of side effects, nausea and vomiting. It can make you sleepy. It can cause problems with horrible constipation and sexual dysfunction. It can lead to convulsions and agitation, lead to abdominal pain and fatigue, lead to weight loss, headache, lead to hypoventilation, shortness of breath, can lead to dizziness, flu-like symptoms, causes problems with your biliary system. And certainly people who are taking drugs like this have impaired mental state, so it's very hard to drive. Well, it's metabolized in the liver through an enzyme known as CYP3A4. That's a big deal, okay? So 75% of the drug is going through that system. Now, that's very important to realize because if you do something to prevent that enzyme from working normally, that means that the drug is not going to be metabolized. It's not going to be excreted in the urine. It's going to build up in the system. So you can take a chemical, take a medicine that's prescribed for some other reason, have it work on this particular liver enzyme, and then all of a sudden you're short of breath, you have respiratory arrest, you go into coma, convulsions, and then you die. What are these medicines? Well, it could be as simple as erythromycin or clarithromycin. Or maybe you take medicine for a fungus infection, ketoconazole, or fluconazole, diflucan. Or maybe you have a heart problem and you're taking verapamil or diazepam. Or maybe you have amiodarone. Even drinking grapefruit juice inhibits this particular enzyme and is very harmful for people who are taking fentanyl. Now, if you discontinue the fentanyl too quickly, you could have withdrawal symptoms because remember, it's narcotic. You can have restlessness, your eyes water, your nose runs, you yawn, you perspire, you have an increase in your heart rate, your respiratory rate, you have insomnia, you have dilated pupils and back pain and muscle pain, and you have the chills. We also know that this drug is potentially lethal to law enforcement. So when they arrest people and they touch even a few grains of this medicine, can lead to respiratory arrest. This is toxic stuff. And unfortunately, it's used as a substitute for white heroin, especially back east. Now, the medical type, the Duragesic, that's manufactured by Alza and marketed by Janssen Pharmaceuticals. They're both divisions of Johnson & Johnson. In 2009, they reformulated the product to hopefully make it less likely to be abused, because remember, it can be fatal with just one single dose. Duragesic should only be used in people who are already tolerant of opioids. So you're on some kind of a narcotic already and you've been on it for at least a couple weeks and you have severe pain that requires round-the-clock treatment. Well, if you take the patch is put on the skin, you put this patch on and you leave it on for about 3 days. Now, there's a problem. Okay, it's on the skin and it's going to be absorbed through the skin. But what happens if you get hot? If you get hot, you're going to absorb more and you can become toxic. You can have the respiratory arrest. You can have the problem with the convulsions and the coma and the death. Simply by taking a hot bath, using a heating pad, an electric blanket. Maybe you go do some strenuous exercise, because exercise is so good for you, but it's not good if you happen to have a Duragesic patch on your skin. Even if you sunbathe and you get red, you have a potential for horrible problem. It's not for use in anyone who's consuming alcohol, and that includes alcohol for recreational purposes or social purposes, and it also includes the alcohol that you find in syrups that you buy, maybe a cough syrup or some other kind of syrup you go and get at the drugstore. Remember, all of those syrups contain alcohol. You put the patch on flat, non-irritated, non-inflamed, intact skin. It deposits in the upper surface of the skin, gets into the blood after a period of about 12 to 24 hours. It's stable after about 72 hours. And after about 72 hours, the dose, the amount in the bloodstream, doesn't seem to change unless you increase or decrease the size of the patch. Now, remember, there's constant absorption through the skin. We talked a little bit about the temperature, but it also depends on how much fat's in your skin, what skin type you are, even which delivery system the manufacturer is using. So there are a lot of variables. This isn't exact science, but if you get too much of it, remember, it could kill you. Problem is that once you start using the Duragesic, and once you reach a certain level, let's say you decide you're going to stop. If you take the patch off, even a day later, there's still half of the quantity left in your system. And that's a potential problem, because when you have an overdose and the paramedics come and they give you a shot of naloxone to reverse the respiratory depression, remember, the naloxone is short-acting, and the Duragesic, we just mentioned, is going to be half of it's still going to be in your system a day later. So that means you have to be under close observation, because if you're not under close observation for 3 or 4 days, you might go back into respiratory depression, and then you might die if there's nobody around. It not only exposes an individual who is using it to problems with addiction and abuse and misuse, even if you use it at recommended doses, but you have to realize that Duragesic should not be used by people whose pain can be controlled through any other mechanism. And especially, we have problems with the elderly, with people who are losing weight, with people who are debilitated, or people who have respiratory disease, or renal disease, or low blood pressure, people who have head injuries, people who have slow heart rate, liver or kidney disease. Got to be careful. You should always underuse the drug. You can always add a rescue medicine, but if you use too much too soon, then unfortunately, like we mentioned, there's a problem. Now, what's the equivalent, let's say, of morphine? Well, if you used about 50 milligrams of morphine, that would equate to about one tiny patch, the 12.5 microgram patch of fentanyl. That's how potent this is. It can be spread by simply touching the affected area after you remove the patch. Because remember, if you remove the patch, there's still some in the skin, and that can be spread to a spouse, to a child. And if you take the patch off and you don't dispose of the patch properly by folding it active side to active side and then throwing it in the toilet and flushing it down, but now let's say a child gets in contact with this medication, starts chewing it or swallows it, that single exposure may be fatal. So it's very important that it is taken care of and disposed in an appropriate fashion. Now, there's another kind of product, and we call it Fentanyl. Fentanyl is a tablet that's placed under your tongue, and it's for people who have flares of the pain, breakthrough pain. Again, it's not for people who have just simple headaches or migraine headaches or neuralgia. It's not for people who haven't been on the narcotics for a long period of time and who've built up tolerance to it. And this drug seems to cause people to become sedated, so it takes away one of the warning symptoms. Now, it's used in an initial dose of about 100 micrograms. You can repeat it again within about half an hour if the pain is still severe. Let's say you have metastatic cancer to the bone and now you have horrible pain. You could use one dose, half hour later if necessary, a second dose, but you can't use any more for at least 4 hours. It's only for that terrible breakthrough pain. And you got to realize that it's not the same as the Dorgesic patch. So all fentanyl isn't exactly the same. Well, what's the cost of these medicines? The cost of the generic drugs are relatively okay. They're not major ripoffs. But the brand name drugs, for instance, if you take the Dorgesic, that's going to cost maybe for the low dose about $400 a month. That's okay. If you happen to take the Actique, that's the medicine that we're talking about for under the tongue, well, that can cost, for the low dose, if you take the brand name, somewhere around $5,000 a month. The higher dose, around $8,000 a month. And if we're talking about the Fentanyl that we use for the breakthrough pain, well, if you take a low dose, can cost well in excess of $1,000 a month. Higher dose, well, $3,000 a month. And that's only if you have one breakthrough episode per day. Multiply that by the number of breakthrough episodes you're going to have. And we have other medicine, a sublingual spray, the Subsys. Well, that costs about $6,000 a month. So what's the take on fentanyl? Fentanyl is a dangerous drug, and it's definitely not to be messed with. Fentanyl kills about 10,000 people every year. About 30 people a day are going to die because they abuse fentanyl, take too much fentanyl, even by a doctor's order. Good drug to stay away from. And remember, this is the drug that killed Prince. So when you think of fentanyl, you want to reserve it for the most disastrous kind of pain that you can possibly imagine. Thanks for watching. I'm Dr. Ken Landau.